Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Associate Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Also happy to be joined by the media who are in attendance this afternoon. And just a reminder, if it's your first time with us for a virtual media briefing or not, or maybe you haven't submitted a question yet, to do so, all you need to do is click on the question mark inside the text bubble here on Microsoft Teams. And if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to all those who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching on the CTV London website. Let's get to the opening remarks, and we'll start this afternoon with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. You know, whether you were out with your kids or handing out candy at the door, I hope everyone had a fun and safe Halloween last night. As for me, I wanted to go as a younger version of Dr. Dukelow, but my hair isn't long enough. So it's going to have to be what it is, and I did not get trick-or-treaters at my place. But look, we are in a better place this year compared to last, and I think that's obvious by that increased number of trick-or-treaters. And most of all, I think it's another sign that we're closer to normal or near normal, and that's becoming all the more common lately. So thanks to everyone who's helped us get to this point. And a reminder, in case you missed it over the weekend, that as of Sunday, this past Sunday, yesterday, proof of vaccination is now required for anyone aged 12 and up when entering any indoor sports or recreation fitness facility in our region. That applies to anyone, even those who are there just to watch. We know this might result in some slightly longer waits to access the facility, but look, it only takes a few minutes. And again, compared to last year, when few, if any, leagues were operating, I think this option is much more appealing. You know, it's interesting, when I took my family out yesterday for brunch, and the owner of a particular restaurant said, thank you. He said, because of our strong position with respect to COVID-19, he said they're able to open fully, and he's grateful for the strong position that the city and the county have taken, the medical officer, health, hospitals. I'm extremely grateful to all of you, and I just want to share that with you. Another request, though, if I can, please be kind, be patient with staff who are working at various facilities, particularly when they request to see your proof of vaccination. I'm not specifically aware of any incidents, but these people aren't the ones making the rules. They're simply doing their jobs. And not only that, but they're keeping all of us safe by doing so. And speaking of keeping everyone safe, I'd like to again remind you to book an appointment today and get your flu shot. The fact we're nearing 90% coverage with first doses of the COVID vaccine, well, to me, that means at least that number should get and will get the flu shot. It's an easy way to keep yourself and those around you healthy this winter, while also ensuring that hospital and healthcare resources are kept available to those who need them most. So again, while we've always said it's COVID time, we're also saying it's flu shot time. And that's all from me, and I'll send it over to you, Warden Cathy.
Great. Well, thank you so much for that, Mayor Ed. And I share the Mayor's remarks in hopes that everybody had a wonderful and safe Halloween. And I, like the Mayor, did not have any trick-or-treaters either. So it was a very quiet household last night here. So I'm asking the question today, what is community? And there are many definitions, but I found this one and felt that it summed it up. It's a group of people living together or in the same locality or who share interests for a common sense of identity. In Luke and Biddulph this past weekend, we saw a community lived out in real time. As has been reported in the media, our local elementary school is experiencing a COVID outbreak. And to follow protocols, a large number of children had to isolate. And because of this, we're missing out on the traditional festivities of Halloween. In true small town fashion, a mom thought about how to reach these kiddies so that they would not feel left out. What an outpouring of support she received. The amount of candy that was donated was beyond her expectations, and distribution was not an issue as families volunteered to help with porch drop-offs. While it wasn't the same, it did provide for a memorable Halloween, one I'm sure kids and families will talk about for years to come. It also served as a valuable lesson to everyone about the importance of community and the sense of identity that it builds. As the mayor highlighted, proof of vaccines are now required for those entering any rec facilities in the Middlesex-London region for those 12 and over. And as he also mentioned, you almost think that we were writing our notes together. But please be kind and respectful of those doing their jobs that are just asking for the proof. They are all just trying to keep us safe. So please remember to be kind and respectful. As I've highlighted many times over the last 18 months, we cannot let COVID and the pandemic overshadow the many other real health issues that we may face. As we begin November, I want to highlight the important focus it has now come to represent. November, as we now know, has become the month to focus on men's health, both physical and mental. As the mother of 4 boys, now men, I am keenly aware of this focus. As I have mentioned many times during the stressful times we find ourselves living in, added attention to our mental health and well-being is paramount, especially for men. It seems that there is added pressure for men to have it all together and all figured out. And quite often, the struggles with anxiety and depression are battled alone. As the mother of a son who struggles daily with depression, I implore you to reach out to the men in your life. Check in on them to ensure they are looking after their mental well-being. There are many resources available online, and now we're starting to introduce back to in-person visits through many organizations throughout our communities. Please take the time to do the research and find local resources to support your male loved ones. At the very least, regularly check in with them so that they know they have a safe and supportive sounding board. Men must also be aware of their physical health. My father passed not from, but with prostate cancer, and I would encourage men to have frank discussions with their healthcare providers. While there is controversy out there about the testing for prostate cancer, it is evident that prostate cancer can be cured when detected and treated early. When prostate cancer is detected early, tumors are more likely to respond to treatment. You are always your own health advocate. So men, or to the men in your life, pick up the phone and speak to your healthcare provider about your health and your health concerns. And with that, I will turn it over to Dr. Summers.
Thank you, Warden Cathy, and happy November to all. I hope you had a good Halloween weekend. Some COVID updates for you today include noting that we're reporting 14 new cases today and no new deaths. Our incident rate, the number of cases we continue to see, is steadily declining, albeit slowly, and with days in which we still see spikes of activity. One area where we've seen some activity is in the Lucan-Biddulph community at Wilberforce Public School, where a large outbreak has been declared with 15 cases reported to date. The school board has proceeded with closing that school in order to provide online education, given the number of students and siblings that are now at home quarantining appropriately. Transmission amongst those who are unvaccinated, particularly, again, those under the ages of 12, can happen before and after school, social and athletic events. And again, we wish our best to that community and are grateful for the ongoing ways in which they support each other, as they did this weekend through the distribution of candy, noting that although it couldn't be a conventional Halloween, it was Halloween nonetheless. Proof of vaccination is now required for anyone 12 and older to enter a sports and athletic facility in the City of London and the County of Middlesex. This intervention, this type of action, ensures that where people can be vaccinated, they are vaccinated, particularly for high-risk activities like athletics. There are other things on the horizon with regards to the vaccine. The National Advisory Committee on Immunization this past Friday released additional guidance around the eligibility of people to receive a third dose of vaccine. We anticipate that the provincial government will provide additional guidance and approval for vaccine for third doses coming sometime this week. We don't know exactly when, but we will watch closely. The Middlesex-London Health Unit will be able to proceed with offering third doses to those who are eligible whenever the province announces that move forward. We'll keep you posted. You will have also noted that late last week, 5 to 11-year-olds were approved for vaccination by the FDA in the United States. Clearly, for those of us in Canada, this makes us stand up and pay attention, hoping that soon too will be an announcement here in our country. We are waiting on additional information from Health Canada. We do know that the information around the Pfizer vaccine for those 5 to 11 is with Health Canada. We don't know exactly when approval may be forthcoming, but it's certainly encouraging to hear of our neighbors to the south proceeding with approval for 5 to 11-year-olds. And again, the MLHU stands ready with our partners to ensure that that vaccine will be available to those who are eligible. If you're a parent, if you're a guardian, if you're an uncle, an aunt, a grandparent, and you've got someone under the age of 12, start having those conversations right now about the excitement of the fact that a vaccine is around the corner. We encourage you to get it when the time comes. I also want to pick up on a comment from the mayor and from the warden that the influenza vaccine is now available starting today, November 1st, to all Ontarians over 6 months of age. The flu did not show up in our community last year, and that is as a result of all the physical distancing interventions that were in place. We're now back to doing many of our activities, and we're glad for that, but it means that we may see more flu activity this year. And the flu still results in hundreds of deaths in our province each year, admissions to hospitals, and greater stress on our healthcare providers. Make sure you get your flu shot. It'll make a big difference, not just to you, but to those around you, particularly those who are older or who are medically vulnerable. Your vaccine is available through many pharmacies and primary care practitioners. Give a reach out, ask the question, and go out and get that vaccine as soon as you can. Thanks as always for this community's kindness to one another through these challenging times, but hopefully we can continue to look for some optimism as November is upon us. With that, I'm going to pass things over to Dr. Dukelow. Thanks, Dr. Dukelow, for joining us today.
Thank you, Dr. Summers, Mayor Holder, Warden Cathy, Burghardt-Jesson, and Dan for once again having me here to share an update on the COVID-19 situation at London Health Sciences Centre. As of this morning, we're caring for 8 COVID-19 positive inpatients, with 5 or fewer of those in critical care. We have also received fewer than 5 critical care patients from our neighbors in Saskatchewan and continue to be available to provide further support as directed by the Ontario Critical Care Command, COVID Command Centre. As well, we do not have any COVID-19 positive inpatients in our children's hospital as of today. This week, we are enacting a couple of policies intended to protect our most vulnerable patients and their families, as well as our staff and physicians. I'd like to begin by sharing that we've enacted a COVID-19 vaccination policy for organ transplant patients. As of today, all patients on the waiting list for organ transplants are required to receive double vaccination with a Health Canada approved COVID-19 vaccine. Those who are not fully vaccinated will be placed on hold until they've received both vaccines or their care team accepts their exemption. The policy is intended to maximize safety for our transplant patients. Like many other issues we addressed prior to transplantation, COVID-19 has a mortality risk that is 2 to 5 times higher in transplant patients than the general population. Research shows these patients will not respond as well or at all to the vaccine if they receive it after the transplant, as the drugs they have to take to slow their immune response will affect the efficacy of the vaccine. Receiving full vaccination before transplantation is our best means to keep patients safe and maximize the use of precious organs. While we have implemented this policy to ensure that the specific patient population is protected from COVID and will have the best possible outcome following transplantation, I do want to stress that we will continue to provide care to all patients, regardless of the vaccination status. As well, I'd also like to take the opportunity to remind everyone that our new care partner policy requiring non-essential care partners to show proof of full vaccination and photo ID at our entrances to our facilities began today. Everyone coming to LHSC should be prepared to show proof of vaccination. As previously shared, there are exceptions in place for those who have been designated as an essential care provider, such as those supporting laboring women and parents accompanying children to appointments. Those individuals will not be denied entry based on vaccination status. I'll be clear once again, because we want to be sure everyone knows this, the policy does not apply to patients. Regardless of your vaccination status, please do not delay seeking or receiving care at our hospital when it's needed. Thank you to our media partners for joining today and to our community for your ongoing support of our hospital. I'll pass it back to you, Dan.
Thank you very much, Dr. Dukelow, and to Dr. Summers, Mayor Holder, and Warden Burghardt-Jesson. Thank you for those opening statements. Just a quick reminder for our friends in the media who are joining us this afternoon. Again, to submit your questions, just click on the text bubble with the question mark, indicating your name, your media outlet, and who your question is for. We do have some questions in the queue, so let's get to those right away. The first is for both Dr. Summers and Warden Burghardt-Jesson. It's from Jane Sims at the London Free Press. Dr. Summers and Warden Burghardt-Jesson, can you give us an update on the Wilberforce school outbreak? We mentioned there is a large outbreak there. And Jane's looking for an update. Are you expecting there to be more cases? And how has this affected the rest of the community? Who would like to begin?
I can go first, Dan. From a community standpoint, Jane, thanks for the question and checking in for sure. You know, Lucan does what Lucan does, and we come together when we have to. And as has been reported throughout the media all weekend, and as I mentioned in my opening statements, as Dr. Summers did, there was a group of mums that organized a candy drive that got candy out to kids that were having to isolate. And that just grew beyond, I think, what that group of mums ever thought, how it would grow. But beyond that, you know, I was at the grocery store yesterday, and you're hearing people just checking in with their neighbors, making sure that everybody's okay. I ran into a mom or family who were picking up groceries, you know, for one of their neighbors who had kids that were isolating, and they were just all hunkering down. So you see them reaching out, supporting one another. I'm not surprised. My community always, you know, impresses me with their ability to come together and show support. And we'll get through this. I think that everybody has done what has been asked of them when asked to isolate. They've done that. They've respected that. And I see that we'll get out of this largely unscathed.
Dr. Summers.
I thank you, Warden Cathy, for those comments. And I think the core of the story of the Wilberforce Public School outbreak will be the community response and support for one another. Jane, to your questions, we have had 15 cases. I believe most of that transmission would have happened prior to the quarantine and isolation measures that are now in place. We may see some additional cases, but our experience with other schools is that once isolation and quarantine is put in place, transmission does drop fairly readily, and the case count will stop growing. In this instance, like in all instances, the communities that are in school are communities that live and breathe outside of school. Athletic activities, social activities, you name it. A child has their friends at school, and they're the same friends they have outside of school. And so I think the community's response to keep that distance, continue to quarantine, continue to isolate, will certainly help this come to a close as soon as possible.
Thank you very much to both of you for those answers. We are running out of questions rapidly, so if you are a member of the media and you want to get a question in, now would be the time. Let's go to our next question. It's from Isha Bhargava with CBC London, and this is for Dr. Dukelow. And Dr. Dukelow, you mentioned that there were some patients from Saskatchewan who are currently at LHSC. What Isha would like to know is, are we expecting there to be more patients coming in from Saskatchewan over the next several days?
Thanks very much. It's a great question. And this is a province to province response. So while we have patients at LHSC, there's been a number of other hospitals and regions of the province engaged. We don't have any specific expected patients in the next couple of days, But my understanding is the COVID critical command table is reassessing that every day or every couple days, and working directly with the province of Saskatchewan and their health system in order to support them. So I don't have specific numbers. Wouldn't be surprised if we admit more patients to Saskatchewan, but can't be specific.
All right, thank you very much, Dr. Dukelow, for that answer. That actually does bring us to the end of the questions that we have in the queue for this afternoon. So I would like to thank you, Dr. Dukelow, Dr. Summers, Warden Burghardt-Jesson, and Mayor Holder, again, for taking the time to be part of these briefings and to bring the information and updates to the community as we continue to face the challenges associated with the COVID-19 pandemic. That will do it for us today. We will be back with our next virtual media briefing coming up Thursday afternoon at 2 o'clock. We hope you will join us then. So between now and Thursday afternoon, have a great rest of your Monday, and so long for now.